Okay, so now we're going to be administering some IV piggyback medication. We're going to administer 500 milligrams or 100 milliliters of levofloxacin, which is an antibiotic that you give at the same time every day. So first I'm going to make sure that I do my steps right. So I have to make sure I have the right patient, right medication, the right time, the right dosage, the right documentation, and the right route. So I'm going to double check my medicine with the MAR and with my patient's bracelet and 2 identifiers. Then I'm going to, before I administer, I'm going to tell my patient that it might cause a headache, maybe some drowsiness, a little bit of insomnia, and then I'm going to want to make sure that I monitor for increased intracranial pressure. So the first thing we have to do is we'll open this up, maintain the sterile film, we'll get out our secondary tubing, and we'll make sure to prime the tubing. So what we'll want to do is find the port that is closest to our bag. This is still sterile. I'm going to clean my port with an alcohol swab. Okay. I'm going to go ahead and attach the extra tubing to the port. And then to prime my tubing, I'm going to go ahead and open it all up and let it fill up with the normal saline so I don't waste any of the antibiotic. So I can see that there's no bubbles in any of my primary tubing or my secondary tubing, and my tubing has been primed. So I'm going to take the cap off my antibiotic and then spike the bag. Okay. I'm going to want to make sure that my IV saline is hung lower than my piggyback medication. So I'm going to hang this up here. And then hang this on a hook. It drops it lower, so the IV medication, so my antibiotic is going to flow into my patient first. So then to calculate my drop factor, or my drip rate, I'm going to do it every 15 minutes so I can calculate it through here. So I take my drop factor, which is 10, it says it on the package, multiply that by 60, because there's 60 minutes an hour, and then divide that by 4 to give me my drop factor for every 15 seconds, so which is going to give me 4. So I'm going to go ahead and open up the clamp on my IV medication all the way, and then set my drip rate based on the primary tubing. So I'm going to watch this flow. Catheter is like not in there, so I got to make sure it's actually dripping. Okay, so I'm going to want to make sure that it has 4 drips every 15 seconds. So I'm going to go ahead and watch that and adjust my clamp as needed. And then once the medication has stopped, I'm going to go ahead and switch it back over to my normal saline into my primary tubing and assess the site for any issues and as well as side effects that could have occurred.